Welcome to Wednesday Wellness Webinar. Today we have a different topic wherein it talks about the naturality of our beauty and also how to be glamorous while fighting mass acne. So I know some of you here experiencing that kind of acne. So right now we have invited a guest speaker. So she was a guest speaker, I think, last month. So she discussed about deep sleep. So right now she's also a dermatologist by profession, and also she's an expert when it comes to about the skin, specifically on how to take care of our faces. So right now here's Doc Pauline Mai Navarro-Corbilla.
Hello, good morning everyone. Today we will be discussing about maskne. So I know at this time all of us are required to wear our face mask to be able to be protected in the ongoing virus or the ongoing pandemic. The spread of the virus now, as we all know, is prevented with wearing of mask. It is inevitable. Some of us, it has been a chronic problem. We have acne caused by hormones, genetics, or whatnot. But now there's a emerging um, problem, which is maskne. So, what is maskne per se? Well, maskne is caused by mechanical pressure and friction that was caused by the mask coming in contact into our skin or on our faces. Well, it doesn't just happen on the face. If you're a medical personnel or a frontliner and you are required to wear PPE, the masks, everything the frontliners wear for protection, it can cause irritation to our skin, therefore acne may develop. Today, we will be discussing what causes acne and how to prevent it. Next slide. Personal protective equipment or the mask coming in contact to our skin is called acne mechanica. So again, it is caused by constant friction, constant mechanical trauma, physical trauma to the skin. It can be due to pressure, to stretching, rubbing, pinching, and or occlusion of the skin. Therefore, the moisture and or the natural oil or the sebum that is produced by our body is being trapped on our pores. Therefore, the pores becomes clogged, and when it becomes clogged, it develops inflammation and therefore produces an acne. Also, there's another form of acne, but a little less talked about. It's called lockdown acne. So people now are developing acne. Even though you're not acne prone, you still develop acne because of the stress. If you've heard before, kung kunwari merong babati sa'yo, o parang ang dami mong pimples ngayon. Dahil lang stress ako or hindi ako kasi masyadong nakatulog kagabi. It is partially true that stress and lack of sleep causes acne. So now in the time of pandemic, we are experiencing this as well. So there is what we call lockdown acne due to stress and lack of sleep. Because lack of sleep alters our body's chemical reactions, thus causing hormonal changes in our body. And hormones, as we all know, affects our skin. So this is generally the pathophysiology of how an acne is formed. So on the first picture, you will see that our body produces natural oils. Sebum is normally beside a hair follicle. Usually, this sebum is excreted through sweating. So once we sweat, that's the time that we will be able to expel the extra oil in our skin. However, when we wear a personal protective equipment or a PPE or a mask per se, we are covering that area. Therefore, the skin is unable to breathe. So on the third picture, you will see the development of the bacteria called acneiform. This bacteria proliferates in the skin, therefore causing inflammation, infection, and thus the acne. So next slide. So also, aside from those factors, given. Also, as I said before, people who had chronic acne before, they had the acne or they have the acne because it is because of internal factors such as genetics. So you have it on your genes, your mom and your dad, they're acne prone. Follicular epidermal hyperproliferation, it just says that your skin is just hyperactive. Your oil glands are just hyperactive and you produce more oil, therefore it's unstoppable. So you have to be extra cautious of what skin type you are in so you'll be able to deal with this kind of problem. The third one is again increased sebum production, just the same. But this one is related to chronic illnesses such as PCOS, if you've heard of polycystic ovary syndrome. PCOS is caused by alterations of hormones. Um, Usually with PCOS, if a patient comes in the clinic and you see cystic acne, even before, even without you wearing a mask. So usually patients, they present with T-zone acne and acne on the chin. Usually these sites or areas are the locations as to where acne develop when the acne is considered hormonal. Also, this location or hormonal acne, it appears cystic, so it's big, malalaki siya. It usually contains pus inside. It develops and grows for a very long time. It requires around 2 weeks for it to be able to fully recover. With PCOS, there is a different treatment for that. So usually I ask my patient to come in the clinic. We give prescribed medications to be able to regulate the patient's hormones. Also, we offer a routine as to which the patient will follow so as the patient will be able to maintain and regulate the hormones again, and also to regulate it externally. How do you do that? So you give the patient products to help with the excess oil, like that. Fourth is again the proliferation of the bacteria. So now, well, even before naman, our hands, now we became extra cautious of not touching our face with our hand. As we all know, the virus lives in inanimate objects, so we are educated to not touch our face very often, with thus the use of face shield now. But the spread of the bacteria, not just the Propionibacteria acnes, um, is not just because of you touching your face. It can be because of inanimate objects again. It can be on your towels, the ones that you use after taking a bath. So you have to at least maintain a good hygiene to be able to avoid bacterial proliferation and infection. And also, if your skin already has previous inflammation and scarring or trauma, may not be due to mask wearing or you touching your face or etc. But you, for example, you had a wound on your face, can be a medium that could harbor the bacteria and thus spread it all over your entire body. It's best that you be able to know this kind of things as to be able to be conscious enough to not spread or cause yourself having acne. So also, again, as I was able to discuss a while ago, lockdown acne. So the number one cause is stress. I can say we cannot really avoid being stressed. Stress per se, you have to be conscious that being stressed now will not really help you and will just cause you to become pangit. Well, stress is inevitable. So, however, we have to be mentally cautious about the overall effect of stress, as I was able to discuss before with about sleep. So, stress again can alter hormones and cause acne. The next slide just shows us other factors that can cause acne. So next is weather. So weather, the temperature here in the Philippines is generally humid. So hot air can cause moisture. Thus, moisture can be a good medium for bacteria proliferation. And also, if there's enough moisture, our pores can be clogged. And if we have clogged pores, and usually clogged pores immediately result to inflamed pores, thus the acne. Overheating, this only applies to patients who wears their mask and or their PPEs for a very long period of time. So we request patients, or at least ordinary people like us, those who are not frontliners, to generally avoid na lang going out so that you don't need to wear your mask or your PPEs at a very long period of time. So those who are not privileged enough to avoid this, so usually we tell them that, for example, a mask, usually we require them to use at least a cover prior to you putting a face mask. Usually we tell them it's best to use silk on the face to reduce friction. So they put silk prior to the surgical mask so as not to cause friction on the skin. Also, it absorbs the moisture than the regular mask, because as we all know, the regular mask is non-breathable, non-porous. Also, it's water resistant, so it won't really absorb the sweat. Again, these are just um, the example of mechanical skin damage that could result through wearing of PPEs and masks. Pressure ulcers, again, to the pressure touch points, usually here on this area, as to where the mask usually fits, also on the chin area. But people also mistake atopic dermatitis with having maskne. Some patients, they only have atopic dermatitis, or other patients, they only have allergic contact dermatitis. People or patients should be able to differentiate which is which. So it is required to be able to see a physician or a doctor or dermatologist so as to be able to recognize which one do you have. Because regular acne or an irritant allergic dermatitis or a contact dermatitis could look the same, but the treatment is very different. So you have to be able to differentiate these things. If you're stressed, again, your immune system is weakened, as I was able to discuss previously. Again, it alters your hormones, it alters your your antibodies. So the inflammatory system hyperreacts or overreacts to all the responses, thus causing and or the trigger of more pimple eruption. It's not just acne that is triggered. Even the genetic diseases such as psoriasis, if you've heard of it, eczema, it could also be triggered by stress. Again, avoidance of stress is, so how do we manage acne? Number one, these are ingredients, the top ingredients of a skincare regimen that you have to be able to find on your toner or on your facial wash to be able to address acne. Most of the time, patients are advised to get one with salicylic acid, azelaic acid, and retinoids. Generally, all these three ingredients, what they do is they remove dirt on your face. Number one, that's the use of it. Number two is for it also increases the epidermal turnover of your skin. Thus, if you because if you have clogged pores, you will not be able to shed the skin. So you have to put something on it to be able to open up the pores. So putting up this top three ingredients will help you to open up the pores to be able to let the pores breathe again. If your problems is related to having whiteheads and blackheads, azelaic acid is a very good ingredient for you. Azelaic acid helps with comedones. So also, if you have cystic acne, azelaic acid will help with the inflammation. So it's best to use azelaic acid. It's still advised to see your dermatologist prior to you using these products. And again, all these three products, we don't really recommend that you just shop and try any products that contains all these ingredients. You have to be supervised still by a dermatologist because what might work for somebody will not work for you, and what works for you will not work for somebody else. So it's best to be able to be guided when you try new products on your skin. And another reminder that I tell my patients when they use a new product on their skin, they have to be able to do a patch test first. So how do you do it? Usually in a store or in a shop or in a dermatology clinic, we have samples, we have testers. So it's best that you do a patch test first. I mean, a product immediately. So doing a patch test, how is it done? So you get your forearm, sorry, get your forearm. So on your forearm, you just swipe up the product on your forearm to be able to test if the product would cause a reaction. So you leave the product on your forearm for at least 15 minutes. If it causes itchiness, redness, a little irritation, or a rash, even minimal amount or minimal sobrang onti lang na reaction, you don't use the product. So what you do again is do a patch test every time you are trying a new product. If you've already done a patch test, but later on you notice that you develop reactions to the product, you stop the product immediately and you consult a dermatologist. Also, what you can do, patients naman talaga, they don't usually want to consult a doctor immediately. So people tend to just switch products. So if you've tried one product and you see it's not working for you or it caused reactions on you, give it just a week and after a week you stop using the product. But you have to give rest time for your skin before you'll be able to use another product. So, it's okay kung ayaw mo talaga, you don't want to see a dermatologist, you don't want to consult a doctor after using a product and that previous product caused you a reaction, it's okay. But you give your skin time to breathe at least a week so as to just let the reaction die down first because you won't be able to know which product caused the reaction really. So for you to discern or to know which side effect is from which product, so it's best to use the product first once and then give it a try for a week. If you've used the product for a week and you find that it is ineffective or it did cause a reaction, again, you stop. Here are tips to prevent maskne. So in general, it's just cleanliness. We dermatologists that just advise patients to maintain your skin clean, wear clean masks, wear clean clothes, prevent any skin reactions. So, in general, again, it is best to change your mask not just every day. You change your mask at least every 8 hours of use. If it's a disposable one, if it's the one that you have to wash, you wash it every day. However, not recommended to really use a washable one, diba? Still advised to use a surgical mask, so it's best to use that one for your protection na din. And also, you have to consider Using something that is not recommended will just cost you a lot of things, like again, reaction in your skin, you getting the virus, or etc. So it's best to just follow the protocols. So next, also for girls naman, as an advice, dermatologists would like to ask everyone if it's not the time to wear your makeup. So yeah, you can skip wearing your makeup every day. So it's best to just um, go up with your bare face, because makeup, as we all know, it's a medium for bacteria to proliferate again. And also, makeup over time, it causes your skin to be oily, and it's like adding oil on oil. So if your skin is normally oily and you put makeup and you go under the sun, you get exposed under the sun, then your makeup becomes oily again. Your pores will be clogged with the makeup, and that does cause the whiteheads and blackheads and or the acne. So it's best to just go out barefaced, but don't forget your sunscreen. Well, here it says don't wear sunscreen. Don't wear sunscreen if you are just at home, not doing anything. If you will not be exposed to UV light, well, wala nang ganun ngayon kasi lahat tayo nagsa-cellphone. So, hindi ko masabi kung sino yung hindi nag-UV light. So, pwede naman tayo talaga hindi mag-sunscreen when you're at home. But when you're outside, it's best to still use your sunscreen. However, sunscreen kasi ngayon or before, there are oil base. So, choose a moisturizer which is water-based. So, it's best to use a water-based moisturizer. A good water-based moisturizer which I could recommend is Derm. If you can't really wear makeup, if you can't really go out without makeup, there's a tinted form or a tinted variant of Derm that you can use. It's very good. Maganda siya. It's widely used by all dermatologists. It's recommended. So, you got to try it. It's a little pricey, but well, skin is an investment. So again, the quarantine or the lockdown acne is caused by stress. You do a sleep hygiene. Sleep hygiene involves, again, if you're comfortable of taking a bath at night, a warm bath will help you. Avoiding bright lights will help you. Putting your cell phone away from you for at least an hour prior to your sleeping time will help you. Or if it helps you to relax, if you have good music, or yung mga titas natin ngayon who put oil, mga ganon, mga scents natin, it will help you to get a good sleep. Go for it. So do everything to have a good sleep at night. At least it's recommended to get 6 hours of sleep. And also to reduce stress, all of you haven't noticed, good self-care, yun yung makakatanggal ng stress. So, if you take care of yourself well, you see yourself na in a positive way, and you see yourself you make yourself look na maganda or positive, develop a good hobby, see to it that you have a healthy lifestyle, a good diet, everything will follow. And also, now we tend to forget to manage our time because we're thinking that we got all the time that we need because we're just at home. Um, some of us have work from home, so we don't really have to worry about time management, but that's wrong. You have to be able to manage your time every day to be able to allot a time for yourself. So also you have to put breaks in between your working schedule. As I discussed before, the Pomodoro method, you have to be able to give yourself a break from time to time so as not to experience burnout. Um, and you have to be able to give a time for yourself para magmuni-muni. Because, again, if you're stressful, you tend to overthink, diba? the muni-muni that I'm talking about is self-assessment as to where you are now, your plans in the future. So it's best to jot down notes for put the time schedule for yourself, set a goal, set the trip for yourself after the pandemic, and it will help you. It will push you at this time. It will help you. So that's it. For you to be able to reduce stress, be positive. Be positive to yourself. Be positive to others. Be kind to others. That's it. So, as a tip, as a dermatologist, I would like to give to you a tip on how to be able to care for your skin. So, basically, these 8 steps are summarized into 4. So, if you need to, this is the general skin hygiene that you have to follow. So, you wash your face with your regular facial wash. Um, And then next is you apply the medication or the treatment that was recommended to you by your dermatologist. So ano to? Usually, to acne-prone skin, we recommend antibiotic creams, the use of benzoyl peroxide with adapalene, the use of, again, azelaic acid and or retinol. So dito yun sa step 2. So, after you wash your face, you do all that, lahat ng may medications. And then, step 3 is to put your moisturizer and or your sunscreen. But, what's the technique? Usually, the patients ask us, Dok, ano bang mauuna? Tsaka paano ba yung tamang paraan para gawin yun? So, usually, we tell our patients, you let your skin dry up first with the previous product that you applied. So, for example, you apply a medication, you let the product dry up first, and then you apply your moisturizer, let it dry up first, followed by your sunscreen. So, that's the order. And lastly, if you wish to put on makeup, you put on something light, something, again, water-based. Yun na yung uso ngayon, a water-based foundation, a water-based sunscreen, a water-based everything. So that's the thing that you have to do now. So if you wish to see me, here on the last slide, I put up my clinic schedule. So you can just refer to this slide if you would like to see me on my clinic. So here's my schedule. Mondays to Sundays, you can see me at Skin Station. So my regular time schedule now is 1 to 5 p.m. But our regular skin schedule after the our reg, our regular work schedule after the pandemic will be 3 to 7 p.m. If you wish to come up and go to our clinic, you can just go. You don't need to schedule because it's just a consult. But if you wish to do a treatment, you might need to schedule. So if you want to check which branches are near you, you can check out the Facebook page of Skin Station for you to be able to know which time schedule and branch works for you. Any questions?
Actually, Doc, I have questions here.
Yes.
So it was sent privately.
Well,
Yeah. So what kind of facial suited for acne?
what type of facial is suited for acne-prone skin? With Skin Station, we have developed specific facial that we recommend to patients. It's different with any other clinic, so you have to be able to consult your dermatologist first prior to having it done. So it's best to not just book your facial. It's best to go to your clinics and consult with your dermatologist first so they know which facial is recommended for you. Again, at Skin Station, it is anti-acne facial, usually combined with red light and glycolic peel. So, what's the use of that and what's the variation? So, usually with anti-acne facial, it's a formulated facial. It is usually done by our senior estheticians. Also, it's combined with red light. What is red light? So red light usually helps patients with a lot of acne, for the acne to be able to reduce to be able to reduce the inflammation of the acne. We put the patient under red light. Also, we do glycolic peeling during the session. So glycolic peel is done every 4 weeks. So this will help um, to increase the epidermal turnover. Again, epidermal turnover opens the pores so as to release yung mga clogged na mga particles sa skin, which causes the inflammation and the infection. So, yun yung usual facial that we recommend to our patients.
I see. How about the interval of treatment? Is there specific time that we can have a facial or paano po yung timing ng facial nun or ng
Okay.
treatment?
It varies from clinic to clinic again, but with skin station, we recommend that you do it, the facial, you do it every 2 weeks, but the glycolic peel, you do every month. So that's the
Okay.
frequency. But again, along with the facial, we recommend other treatments pa kasi. So it's best kasi we believe that treatment varies from patient to patient, so it's best that the patient comes over for a consult first bago kami mag-recommend.
I see. You mentioned earlier kasi Doc na you are recommending mga topical ointments for acne. Now, is oral meds also is safe for acne treatments? It's like we are seeing at the advertisement, may mga capsules. Is it safe
Yes.
to buy it over the counter or is
Wait.
it with prescription?
No, it has to be with prescription. So,
Mm.
acne, the commercially available, na very famous that we have is lactazine, if you've heard of it.
Mm-mm.
Um, I am not paid by lactazine. However, I usually prescribe it to my patients because I can see good results, but it varies. Not everyone gets good results. And along with it, I combine it to other medication, oral medication, and you don't give it to all your patients. So all my responses will be to consult your dermatologist first because we
Okay.
have to really see your current skin condition prior to us recommending the treatment. Oral medications are just indicated for patients who really have problematic acne. So moderate to severe acne are the patients who require to have oral medications, but those who have mild acne,
Mm.
yung mga home regimens and a simple facial would help. Yun lang. Even that would help a lot. So it's best to really consult first prior to trying any other treatments agad.
I see. Well, that's good. At least we cannot really buy over-the-counter products lang na basa-basa. And I know
Yes.
for sure it can also affect our liver if mali yung nabili natin na milligram, I think.
That's true. There's a medication that's if you've heard of Acutrex or Acunex, mga ganyan. Usually, patients would buy it from everywhere, kahit
Mm,
hindi sa drugstore. If you come at the drugstore to purchase it, they will not give it to you without prescription.
prescription.
Yes. However, patients are trying to buy it online or wherever, and they are not aware of the side effect or the
Mm-mm.
complications of taking it. So I would like to warn everybody that this specific medication causes liver and kidney problems. So usually before we start this medication to patients, dun na tayo sa severe acne. And
Mm-mm.
also, we do laboratory tests. So we test
Okay.
for kidney and liver function first
Functions.
prior to giving this medication. So again, it's best to see your dermatologist first.
Yeah, and I would like also to add, Doc, kasi nga, liver and kidney, sila kasi yung nagfi-filter ng mga medications natin or they metabolize mga medications.
Mhm.
So, siguro, That's why high risk talaga yon if you are having a malfunction na kidney or liver kasi hindi niya
Yes,
ma-metabolize yon.
that's true. Yes.
Yeah. How about pimple patch, Doc? Kasi may nakikita akong mga gumagamit. Is it okay to use or no?
Actually, pimple
Depends.
patch, hindi ko siya nire-recommend. I'm not recommending patients to use this.
Pimple
A lot
patch.
of patients come to me because their pimples are too big. And when I check on it, I would usually ask them, nag-pimple patch ka, no? Ay, opo, doc. Paano mo nalaman? Usually, a patient who puts on pimple patch or a patch on a pimple, the pimple flattens superficially. So, um, wow, magdodrawing ako ah. So, okay. Let's say this is a pimple. So, a pimple is usually round. So, it's round because of a capsule. A capsule of a pimple is usually expelled during a facial. But if you put on a pimple patch, this will be flattened. This is the external portion of the acne. So this portion will be flattened, but the capsule or the growing inflammation will continue underneath. So you will notice after putting on a pimple patch, the pimple, yes, it flattened. So you're guessing or you're thinking the pimple is gone already, but the
Mm-mm.
capsule is really underneath and it's growing big underneath neat. So hindi talaga siya nawala. So what's best is to not use a pimple patch kasi yun nga, you're thinking it's not there anymore. However, pag kinapa mo siya, meron pa rin siya sa ilalim na parang hard na
Ah.
bilog dahil
Mm-mm.
may capsule yung acne. For you to be able to expel that, you have to be able to open the pore. So, that's the use kung bakit din tayo nag-facial. Kasi, ini-evacuate yung buong capsule.
Mm-mm.
Ano po yung capsule? So, yung capsule, it is usually synonymous to when you break an egg, the thin white film that you can see, yung pag nagbasag ka ng itlog, di ba
Mm-mm.
meron siyang white film na tatanggalin? Yun yung
Mm-mm.
same consistency as a capsule of an acne. So that one, um, notice when you pop a pimple, you can see parang vein-like may buo kang makukuha.
Mm-mm.
That's the indication that you were able to excavate the whole capsule. Because if you're not able to remove the whole capsule, it will continuously grow and be infectious. Kaya siya lalaki ng lalaki. So, yun yung nangyayari with putting in a pimple patch. Nawawala lang yung inflammation sa ibabaw because the pimple patch generally helps with the inflammation. But underneath, dun siya nag-grow. So, lalaki siya ng lalaki. The capsule hardens. Pag nag-harden siya, it becomes a scar. So, imagine that the capsule that has grown underneath, titigas siya. And if it hardens, that forms the cavity as to where the scar will develop. So, ito, titigas na siya, mag-harden siya, kaya siya, scar na siya after a period of time. So, it's best to remove the capsule ng buo. So, that's why they use or the requirement of doing a facial.
I see. Well, that's clear. And Doc, meron kasing mga taong nakikita ko din, they used to prick also their face. Is it safe ba or may specific device talaga na gagamitin to prick
Um,
it or do we really need to go to our dermatologist?
pricking your face is really not good, no? So,
Okay.
because you don't really know if you've done the right technique, if you've used the right equipment. Kasi you can do more harm to yourself than helping your skin. So it's best to let a professional or a trained person to do it for you. And also, kapag nagpiprick ka kasi ng acne, usually again, they don't know na basta nag-pop na okay na sa kanila eh. But some says, pag nagdugo na and they were able to pop it, it's done. The acne will be gone the next day. But have you ever experienced, mapop mo na siya, pero kinabukasan, andyan pa din? It's because you weren't able to expel the capsule. So,
Mhm.
popping your pimple has the right technique, and it's done by a trained person. So, you don't just do it at home.
Okay, I think some of the questions here were answered. So before we end, we have a short advertisement here. APOSI recruitment goes virtual. So we can apply from home, get hired from home, and then we have job openings to our operations. Client care associates, Vietnamese speaker, client care associates, online proctor, customer care associate, customer success specialist, study startup and data entry specialist, training associate, and then for the support, we have HR generalist, learning and development manager, company nurse, marketing assistant, creative designer and developer, application developer, and facility staff. So it's just 5 steps to apply. So we can have online application, over the phone initial interview, online exam, pre-final and final interview. Job offer will be discussed via Skype. So that's just easy. So don't be shy and apply now.